Irritable bowel syndrome, also known as IBS, is literally one of the most common causes of chronic or recurrent abdominal pain among children. According to various studies, 8 to 25% of children and adolescents experience some degrees of IBS symptoms. Two core clinical manifestations of IBS are abdominal pain and changes in bowel habits such as constipation, diarrhea, or both. Besides, many children continue to have symptoms into adulthood, and in many adult patients with IBS, symptoms may be traced back to childhood as well. From a physician's point of view, IBS is not a dangerous or worrying disease. It does not cause malabsorption, does not increase the risk of digestive cancer, and does not have any negative impact on your child growth rate. But there is one negative point about IBS. It can have a significant impact on your child's daily activity, education, and quality of life. IBS, especially its abdominal pain, is a well-known cause of absenteeism at school. Now a big question for many parents is, what can trigger IBS? And is it a preventable disease or not? In fact, there are 9 conditions that can enhance IBS development. Stay with us to get familiar with them. There are multiple contributing factors involved in pediatric IBS development, and most of them are divided into 2 main categories. The first category is hygiene and gut dysbiosis. Human body is full of countless collections of beneficial bacteria. The number of bacteria in your gut is vast, 50 trillion or so, which nearly equals 1 for every human cell in our bodies. Thankfully, majority of intestinal bacteria have positive effects on our health. Generally speaking, gut dysbiosis happens when the bacteria in a child's alimentary tract get out of balance. This can cause a decrease in number of beneficial bacteria such as bacteroidetes, and an increase in pathobionts. According to medical terminology, pathobionts are potentially harmful bacteria that are able to promote pathology only when specific genetic or environmental conditions are altered in the host. A good example of pathobiont is Ruminococcus torx. Studies have elucidated that Ruminococcus torx reduces gut barrier integrity in IBS patients. Besides, this bacterium is associated with severity of IBS symptoms. Multiple conditions are shown to negatively impact on gut microbiota and promote gut dysbiosis. Shorter period of breastfeeding. This may be due to the colonization by beneficial bacteria in breast milk that stifles the growth of harmful bacteria like Clostridium difficile. Childhood environmental factors, especially bedroom sharing and pet exposure, are associated with IBS later in adulthood. This may be due to high exposure of gut to pathogenic microbes. It's apparent that antibiotics and intestinal infections can change bowel microbiota and thus increase the risk of IBS in children. Studies recommend that gut microbiota of infants aged 1 to 24 months is extremely sensitive to disturbances from both antibiotic use and bowel infections. So, even a transient or small change in bowel microbiota, such as antibiotic use, can trigger IBS later in adulthood. It's hard to believe that even caesarean section makes kids prone to IBS development. That's because caesarean delivery can deplete bacteroidetes populations, changing establishment of maternal bacteria. So, infants that are born vaginally have a larger diversity of bacteria in their intestinal system, which simply reduces the risk of IBS. Interestingly, children experiencing intestinal infections in early life are at greater risk of developing IBS in adulthood. This is so-called post-infectious IBS. Just as a reference, a study on 204 children showed that Salmonella gastroenteritis during childhood is a risk factor for development of IBS later in adulthood. If you know any other condition that can trigger IBS through gut dysbiosis, let me know in comments down below. The second category is mood and emotional disturbances. Like many other diseases, psychological factors play an important role in IBS pathogenesis. Corticotropin-releasing factor, or CRF, is a hypothalamic hormone and a major element of stress response. Overactivity in the brain CRF contributes to anxiety and depression. On the other hand, an amazing study in 1998 revealed that intravenous injection of CRF induces abdominal pain and colonic motility in IBS patients to a higher degree than normal controls. This simply explains the association between emotional stress and IBS development. Anxiety, depression, introverted personality, and psychologically, emotionally, physically, or sexually child abuse are some known emotional stresses that have a role in IBS pathogenesis. If you know any further psychological factor that can enhance IBS development, let me know down in the comments. Thanks for your watching. Please let me know the pediatric issues you are willing to learn. Write them in the comments for me. Good luck.